Today I'll be talking about giving an overview about thermal imaging, but in a data science perspective. The agenda of this talk is as follows. First, I will cover basics of thermal imaging, followed by manual interpretation challenges. Then I will talk about some AIIMA clinical use cases, and some of the open source data sets that we can leverage, and then what it takes for deploying this solution in clinical practice. What is thermal imaging? It is nothing but measure of surface temperature distribution. Every body emits long-wave infrared radiation. What thermal cameras do is that they convert these long-wave infrared radiation into temperature values. What we are seeing is a thermal image of a breast region, and each pixel here represents the temperature value. Since the temperature values are crux for the interpretation, let's understand how these temperature values are really obtained. So let's say if you want to get temperature distribution of a target object, what infrared thermal camera receives is three different emissions. One, directly from the target object. Other, the emission that is reflected, that is generated by heat sources, surrounding heat sources, but is reflected by the target object. And third one is atmospheric emission itself. Infrared thermal cameras internally use some parameters to construct the temperature of the target object by assuming some parameters. So let's go into details of these parameters, because it is important that we set these values to their true values. Otherwise, what the temperature values we might see might be deviating from what the actual temperature values are. The first one is emissivity. Emissivity of an object is defined as its capability to radiate thermal infrared radiation compared to a black body at the same temperature. Emissivity value of 0 indicates a perfect reflector, whereas emissivity of 1 indicates that it's complete absorber like black body. Most thermal cameras, if you see, it comes with a default value of emissivity of 0.9 or 0.95. So it's important that since we are talking about medical thermography, we have to set this value to 0.98, which corresponds to the human skin surface. And depending on the racial features also, this value can be varied from 0.95 to 0.98. There's interesting papers on what emissivity value we can set for different humans. The second important parameter is reflected temperature, which corresponds to the amount of thermal infrared radiation emitted from background or surrounding objects, but is reflected of the measuring object. That is why it is important to ensure that there are no strong heat sources or reflective surfaces near the imaging area. If you ensure that, you can assume this value to the environmental temperature such as 20 to 24 degrees centigrade. The third parameter is atmospheric transmissivity, which is the ability to transmit the thermal infrared radiation. It depends on the relative humidity in the imaging area and also distance between the camera and the measuring object. But for most of the practical medical thermography scenarios, this value would be very close to 1. The next parameter is atmospheric temperature, which is nothing but the ambient temperature. This you can get it using standard room thermometers. But since atmospheric transmissivity is tending to 1, this parameter has minimal influence. Fifth parameter is Boltzmann constant, which is a constant value. So let's see a demo how these values could really impact the temperature values of what we are measuring. So this is a thermal image, and we are tracking the pixel temperature at this point. So this is captured with the default camera settings, which has emissivity of 0.95. If I change this value to 0.98, you can see that the temperature dropped by 0.2 degrees centigrade. And this is not like a uniform temperature. It depends on the pixel also. And if we change the reflective temperature, we again saw a dip in the temperature. Whereas when we adjusted atmospheric temperature or relative humidity or the distance, it didn't impact that much. Whereas these values also might get influenced depending on the temperature values, what we see. What thermal cameras are giving us is raw temperature values. So for human interpretation, we require them to convert into thermal images. For this purpose, we use color bars and we transform these temperature maps into thermal images. So these are the four commonly used color palettes for converting into temperature images. Rainbow color palette is very predominantly used because it can highlight the abnormal region properly. So what happens is any temperature is less than 20.9 in this scenario is assigned to blue or dark blue. And anything above white is assigned, anything above 31.8 is assigned to white. And grayscale, animated grayscale, both are used specifically for analyzing the vascular changes because we can see the vascular structures in these color palettes well. Iron hot color palette is a general thermal imaging palette, but it is used very minimally in medical thermography. But this is also another standard color palette which we typically see in medical thermography. So when we convert these temperature values into thermal images, there is an important parameter that which can change the interpretation significantly. It is temperature limits. So what you are seeing here, both are obtained from the same temperature matrix, but with different color bar temperature limits. So the left-hand side is obtained using a rainbow color palette and with a temperature limit of 25 and 39. Whereas same temperature matrix, same color palette. But if we change the temperature limits to 38 and 46, we are seeing a significant heat pattern. And this is biopsy proven malignancy. So that is why manual interpretation requires high expertise and also could be subjective. And not all high thermal patterns can be due to malignancy or any kind of abnormal activities. It could be due to benign condition also. And manual analysis of hundreds of thousands of pixels of different color shades representing temperature values could also be taxing for the manual thermographer. That's where AI can help. So over the last few years, we have seen the applications of AI over infrared images in medical usage in variety of areas. I'll be briefly covering about some of these areas in this talk. AIIMA for breast cancer. It is one of the predominant use case which we see. The high metabolic activity required for cancerous growth is fueled by increase in blood supply, which increases the heat pattern of the tumor region as well as the surrounding region. The latest infrared thermal cameras can capture minute temperature variations up to 0.05 degrees centigrade. And with the help of AIIMA, that is the use of AI over infrared images, we can differentiate whether it is a normal or a malignant heat pattern. If you want to start working in this area, there is this open source dataset called breast thermal imaging dataset from Visual Lab, where you can see the breast images in their standard views as well as the time series data. Using this, you can work on the problems of breast region of interest segmentation, that is identifying where the breast region in the image itself is a ML problem, and classifying whether the image is malignant or not. And since we have time series data, you can even track the tumor response, tumor heat pattern and also classify the tumor. And then 3D modeling, which indicates both breast surface reconstruction from the standard views, which we'll be seeing as one of the data challenge in this AIIMA 2023, as well as the internal 3D modeling. Diabetic neuropathies of foot is another area that affects nerves and can lead to loss of sensation, pain, and even ulcers or infections. Again, these can cause changes in heat patterns. And with AIIMA, we are able to classify whether it is a diabetic foot complication or not. And there is a dataset called plantar thermogram dataset, which has multiple foot images and their corresponding foot complication as well. So you can use this data set for identifying where the region of interest is, localizing where the problem is, as well as classifying whether it is really due to some kind of foot complication or not. Onchocerciasis is a very recent development where we found that the use of AIIMA can be used for identifying oncoworms in a non-invasive fashion. High metabolic activity of oncoworms, along with its associated angiogenesis, generates more thermal pattern, and we can analyze these temperature values for identifying whether it's oncoworm or not. And the recent even update also says that we can even classify the fecundity or the density of worms as well. And we have an open source data set for this problem as well, called Onchocercasis thermal imaging dataset from Niramai. So you can use this dataset because this dataset has both RGB and thermal images. And since we're capturing the image from far, and we might be having unwanted region, as you can see here, it is the claws, what we are seeing. So you can use it for region of interest segmentation. You can identify where the onconodule is and then classify it as well. Fever screening is an area which has picked up during COVID-19. It has its own advantage because using thermal-based fever screening, we can make it completely privacy aware. And we can do 24-hour surveillance, unlike RGB, where we have illumination constraint. And we have data sets. We have two open source data sets here. One is COVID-19 thermal screening NTIC dataset from Niramai, which has thermal images of people walking into public places and their corresponding facial locations. So you can use that for thermal face detection. And you have a data set corresponding to mask and their corresponding labels. You can use it for mask detection or classification, and finally, body temperature estimation. There is another data set from University of College London, which has open source the data set of thermal images and the thermal phase locations, as well as the respiration rate, because respiration rate is also another parameter which could be an important parameter for fever screening. Head and neck is another area. The vital arteries transmits blood to brain, head, and face, and any kind of condition that lead to vascular changes can be studied with AIIMA. So we have a good open source data set, again from Visual Lab, called Thyroid Thermal Imaging data set. You can use this data set for identifying where the neck region is from the images that we capture, and identifying where the nodules are, segmenting them, and then classifying them, whether it is any kind of thyroid abnormal malignancy or it is a normal one. So the last use case which I would be discussing is related to injuries, musculoskeletal disorders, or wounds. Whenever the muscle tissue is strained or torn, it releases chemicals that result in increased heat pattern. Similarly, deep vein thrombosis and other circulatory disorders of lower extremities can result in variations in heat patterns. And degree of burns, wounds can even be studied with AIIMA. There are not much open source data sets related to injuries or musculoskeletal disorders, but we have this chronic wounds multi-model imaging data set, which consists of both thermal image as well as visual image. And we can use this for identifying where the wound is and identifying where the region of pain, and then classifying it into what kind of wound as well. So this is a slide that talks about if you have a AIIMA clinical use case, what does it take for taking it into clinical practice? The first one is identifying a problem statement with a true clinical need, then assessing whether the clinical use has more benefits over risk by comparing with existing technology. And then the next important step is curating the data. Understand whether the data is of high quality or not. Understand whether the data is authentic or not. What is the ground truth source for getting the annotations? And check for any kind of potential biases that you might foresee. It could be due to the data source as a bias, imbalance is a bias, or what are the inclusion criteria that are involved while data collection. Once you are confident on the data, the next step is developing AI models. You can use off-the-shelf AI models or custom AI models, but it is important that once you develop, evaluate the models on independent data sets. Explainability and interpretability of AI outputs are very key for clinical integration. So ensure that your models are explainable and interpretable, and keep this in mind from the starting of the model development. Make your models more generalizable as well as reproducible, and understand where the model works and where the model fails. Once you have developed this AI model, the next step for any kind of medical use case is obtaining regulatory clearances and conducting the clinical trial. So both takes a lot of time. So start from the beginning itself, like what clinical trials you have to conduct, and define the clear objectives and clinical outcomes of the studies, and ensure that the clinical objectives that you are assessing corresponds to the intended usage, what you want to claim. And plan for prospective studies, because prospective studies are lagging in thermal imaging, and they are the studies which increases credibility. And once you get the regulatory clearance, the job is not done. You have to work with doctors and understand how you can make your solution more clinically adaptable. Continuously monitor your model to check for any kind of accuracy changes, and then retrain the model if required. You can either opt for manual retraining, or you can go for active learning strategies as well. There's a very interesting talk by Dr. Squaj, chairman of American Academy of Thermology, which discusses how the medical thermography has been standardized over the years. I highly recommend everyone watch this video on how the standardization has been came across in thermography over the years.